Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. To welcome Dr. Laura James to the show today. She is a board-certified naturopathic oncologist with over 20 years of experience supporting adults through cancer diagnosis, treatment, and recovery. Her integrative approach blends evidence-based natural therapies like nutrition, herbs, gentle movement, and stress management with conventional cancer treatments to reduce side effects, support healing, and lower the risk of recurrence. Dr. James holds a doctorate in naturopathic medicine from Bastyr University and a bachelor's degree from Tufts University. She is a fellow of the American Board of Naturopathic Oncology and has served as faculty and speaker for organizations such as the Fred Hutchinson's Cancer Research Center, Bastyr University, Evergreen Healthcare, and the Susan G. Komen Foundation. Her clinical focus is breast cancer, and her work spans every phase of care, from active treatment through survivorship. She also developed the Red Cedar Wellness Center into a full spectrum integrative clinic offering naturopathic care, acupuncture, and massage therapy. Dr. James is passionate about helping women build resilience, understand their risk, and navigate cancer with clarity and compassion. Whether it's designing her personalized nutrition plan or guiding someone through chemotherapy with natural support, her mission is to help patients thrive during and after cancer care. And we're so excited to have you on the show, Doc. Welcome to the podcast.
Thanks. Thank you for inviting me. I'm happy to be here.
All right. So you are my first naturopathic oncologist. And so I'm super excited to dive into the science with you. As you know, this podcast is created for other providers. And so really wanting to educate them as to why these types of treatments, enhance and support traditional medicine. And so I love that is exactly what you do. So it's fantastic. All right. So can you give us a little, just tell us a little bit about your professional journey into functional and integrative medicine and give us a brief overview of the training path that you chose?
Yeah, sure. So I decided a little bit later in my 20s that what I really wanted to do was become a physician. And it took me about a year and a half to decide whether or not I wanted to go to naturopathic medical school, or go to conventional medical school. I'd worked as a medical writer for 8 years before deciding I wanted to go to graduate school. And really, what tipped the scale for me was that in the 1990s, conventional medical schools had practically zero education on nutrition. And I was very much of the belief, both from personal experience and my own diving into medical research, that nutrition was really key in terms of maintaining health or attaining health from a disease state. And so naturopathic medicine really called to me, both from the nutrition standpoint and from the botanical medicine standpoint. The overall philosophy is to use less force when working with a patient. And something that's like a pharmaceutical or surgery is highly forceful on the body, right? And so being a holistic provider, a naturopathic provider, I aim to work with less force to attain change. And nutrition is a really, really big part of that. So that's what got me interested in naturopathic medicine. And naturopathic medical school is very similar to conventional medical school. We learn all the same science, but we also learn nutrition science and botanical science and osteopathic type manual therapy, massage therapy. We learn a little bit of traditional Chinese medicine. So it's not just a, clinically oriented medical school program. It's also all of these other therapies, which makes us integrated to start with, right?
Right. Wow.
Yeah.
Have I been saying it wrong for all these years? I've always said naturopathic. Is it
It's
naturopathic?
both. It's both.
Okay.
I say naturopathic, that's habit. Other people say naturopathic, but I hear it pronounced both ways.
Okay.
Ultimately though, what I am is an integrative oncologist.
Correct.
So, I have specialized in oncology. I've done a board certification training, residency, all of those things around oncology. And, I kind of had to learn conventional oncology first and then be able to overlay the naturopathic approach. And so it very much is an integrative approach. So, it's not just prescribing a few teas, it's understanding the pharmacokinetics of conventional chemotherapies and figuring out what can be coupled with that, knowing what the half-life of the drug is going to be so that you're not interfering, right?
Love that.
So it's a lot. It's a very scientific approach, and it's a very evidence-based approach.
I met a integrative oncologist. He was a traditional trained
Hmm.
oncologist, and then he went into integrative medicine in Nevada many years ago. And he was so sought after. I think he ended up in Washington, but he had so many job offers from all over the country because there was nobody doing that at the time. This was maybe
Hmm.
10 years ago. And so you're the
Hmm.
second integrative oncologist that I've met. So you're kind of a rare breed. I mean, I'm sure why don't we talk about that a little bit? So, how many integrative oncologists are there in the country, and is it growing? Is this something that physicians are saying, you know what, we really need to be looking into this?
So it's interesting because, I actually started out my career, as I said, as a medical writer, and I was working in oncology at the time. I worked for a very big cancer research center on the East Coast as my
Okay,
first job out of college, and there was nothing. Right, there was nothing integrative in the early, late 1980s, early 1990s. I went to naturopathic medical school in the late 1990s. And at that time, also, there was very little in terms of integration. And integration has taken many different forms, but I do want to differentiate between a naturopathic oncologist like myself
yes,
and
a traditional, sure,
a medical oncologist who has integrative training. I am an ND and I have a license in Washington state. I could be licensed in half of the states in our country. I can't be licensed in all 50 states because we
right,
don't have licensure in all those states. MDs can basically do anything and go anywhere.
right.
And, a medical oncologist who chooses to learn integrative therapies has different choices than the fundamentally philosophically integrative education that we start out with, right?
Agreed. I've
And
I've met
so,
very few
yeah,
MDs that are both MDs and NDs,
that's
right?
rare.
It's very
Yeah,
rare, but I have
that's
met a
very rare.
couple. Yeah,
Yeah,
but I've met a
there are a
couple. It's
couple,
pretty
but
cool.
it's pretty rare.
Yeah, because the
And
training's like 8 years on top of your
yeah,
15 years. I mean, it's this is
right,
the amount of training
right.
you're talking about 20 years of training.
Right, right, exactly. And, for me, I got into working with patients with cancer sort of sideways. Like I didn't start out working with patients with cancer. And then I built up towards becoming a board certified naturopathic oncologist, which is it's a process.
Sure.
And those of us who are board certified naturopathic oncologists, there are really only about 150 of us in North America.
Wow.
And that's it. Like, that's it. We are an extremely small, highly specialized field. And part of it has to do with licensure. But, it's still an uphill battle to physically integrate with cancer centers. Um, and I've practiced. So in Washington state, I'm licensed as a primary care physician.
Right.
So in terms of scope of practice, ability to diagnose, treat, order labs, order MRIs, and practice medicine independently and prescribe, I can do all of that in Washington state. That's what licensure gives us as
Right.
naturopathic providers. Um, Even in Washington state, I've watched for the last 25 years the sort of pathway of integrative oncology. And to be honest, I wish it were better. I wish it were more enlightened and less, shall we say, institutionally restricted. And I think that's the case around the country. There's an organization called the Society for Integrative Oncology that's been around for, I don't know, 20, 25 years. They represent, I want to say, like 40 plus integrative oncology centers at major medical centers around the country. And so there are those, but if you think about how many cancer centers there are in the country, it's still just a fraction. And part of the
Well, you need to have the clinicians in order to have those programs. And if there's only 150 of you in North America,
right,
you couldn't
right,
even if they wanted an
right,
integrative,
right,
practice in
right,
their cancer center, there's not
right,
enough of you guys to go around. So we need more
right,
providers, if you're listening,
right,
to follow this
right.
path.
Right. But there's also an insurance restriction,
Of
right? I
course.
mean, any provider that spends more time with their patients isn't going to get as good,
Right.
reimbursement coverage
Of
from the
course.
insurance model. And that plays a role in the institutional setting,
Of
right?
course.
So, the best and most successful integrative oncology programs I've seen are independent from big major medical centers. They just
Sure.
are, you
Right.
know?
So
So
they're not controlled by insurance. All
no,
right.
and I was hoping that in my clinical practice life, things would be different, but I've been at this for 25 years and it's not. So,
Well, I would say, and I talk about this a lot because, you were a pioneer, right? You're
mhm,
part of the pioneers. And so it's kind of like the people that came, the pioneers that came to the United States, they didn't envision what we are today, right? So I think, if we were to look 100 years from now, this will be old hat, right? This will be in every
mhm, mhm,
oncology office. But, we had to start somewhere. So yes, would we like to see it more so? We would,
mhm,
but it's slow. And, again, that's why I started this podcast, to inspire other providers to
mhm,
keep continuing their education, to learning more about the natural medicine. So let's dive into it.
mhm.
So, what are the most common root causes that you see in your patient population, and how do you address them?
Good question. So, for the last 10 years or so, I have only worked with patients with cancer and predominantly those patients with breast cancer. So, for a long time, I did women's health and women's cancers. But, if I could tell you what the root cause of cancer was, I'd have a Nobel Prize, right?
Right.
And
Well,
so I
and,
don't
and
have
I'm not
that.
asking for the root cause of cancer. I'm asking for the root cause of what's the most common root causes that you're seeing in your breast cancer patients. Is it inflammation? I'm looking for, give us some of
Yeah.
the markers that
Yeah.
you're used to
Yeah.
seeing.
I mean, again, that's really hard to answer because a breast cancer is not a breast cancer, is not a breast cancer, is not a breast cancer, right?
Ah,
Breast cancer is this huge umbrella
okay.
of um, types of cancer. And within the types of cancer, the the histology and the pathology of what's going on at the cellular level. And then you overlay the genetic information, the genomic information. There are so many layers
Okay.
to an individual woman's breast cancer experience. But yes, I will say the things that I look for
Okay.
are inflammation, blood sugar dysregulation, endocrine dysregulation, environmental exposure, and a certain amount of genetic variance. And I'm not talking about like BRCA1 and BRCA2, which are extremely well known oncogenes that increase a person's risk of particularly breast cancer in their lifetime, right?
Okay.
And those are genes that can be tested for. You can do a test at home. Um, and those are the most famous ones that I'm bringing
Okay.
up. There are a whole lot of other oncogenes that also can be tested for in a conventional setting, which indicate risk as well as potential for severity and or treatment. But there's this whole other level of genetic information that people in this naturopathic, integrative, functional medicine world are looking at to really understand what I call the biochemical terrain of the body, right?
Okay.
And some of that has to do with detoxification, right? Like how well your body processes those environmental influences, the estrogen in your body, those kinds of things, right? And so looking at someone's biochemical terrain is where we can start identifying, as you're calling it, some of the root causes that are going to be contributing to why a woman's body is making cancer,
Right.
right? And many of those things are things that we can act upon,
Yes. And we're
right?
going to dive into some of those things because, I've
Mhm.
heard some things over the years that I want to throw at you.
All
Do you
right.
want to, since this podcast is for providers, do you want to dive in
Mhm.
a little bit into those other biomarkers that you're looking at, or is it too many and too broad for this conversation?
I
And
think
they
it's
could,
too many and too broad.
gotcha.
I think it's too many and too
Okay,
broad,
so we'll
but
we'll move. Go ahead.
it's the idea that there may very well be these indirect influencers of the biochemical terrain from a genetic standpoint.
Gotcha. All right. And if they have questions, they can call you. All right. And then what labs or diagnostic tools are you finding most essential to uncovering the underlying imbalances in your patients?
So I don't do protocol medicine really. I don't, when someone walks in to talk to me, I don't necessarily say we have to do these 6 tests, right?
Okay.
It really depends on where a woman's at. And I see, and I'm just going to keep this conversation specifically to breast cancer patients, but
Please.
I see women from the start of diagnosis where they've had a screening mammogram that showed something and they're flipping out, to women who are, totally done with their treatment, to women who have metastatic disease. So I see women across the whole spectrum. And, the best place for me to intervene is going to be when a woman is first diagnosed, because then we can gather a lot of information. We can do a whole bunch of tests. And that's a great place to start with. Just, there's some standard labs that I like to do, like high sensitivity CRP, hemoglobin A1C. Let's take a look at homocysteine because it's a quick and dirty marker of methylation. Let's look at D-dimer and fibrinogen and look at coagulation. So there's a panel of just regular old blood tests that we can take a look at to start with. It might be relevant to do some of that detoxification genomic evaluation. That tends to be expensive. So often I'll bring it up and I'll say, you only have to do it once, but it's like $500, and, sort of negotiate with the patient on that one, but it can be very useful information. And nutritional testing, let's see if there are deficiencies to start with. I'll absolutely do nutritional testing as well as toxic element clearance testing when someone's done with chemotherapy, for example, right?
Okay.
So, when their body has gotten depleted from the drugs,
Sure.
then we'll do some highly specialized testing and see what has to be replenished, right?
Okay. And are you also looking at, I've heard other functional medicine doctors talk about like cortisol levels and poop tests and food sensitivity tests. Does any of that come into your scope, or that really doesn't apply?
It depends on what the symptoms are.
Okay.
If a woman has a lot of GI issues, which may be worsened by the treatment that she's looking at, then I'll probably do some kind of GI testing. I don't do it as a matter of course. And certainly, going through cancer treatment can be really hard on the gastrointestinal system. So often I'll treat empirically if she has problems through treatment. I'm not always looking for something really specific there, right?
Gotcha.
Yeah.
Yeah, I recently had integrative MD on here, and her specialty is the GI stuff, and she was just raving about the probiotics and how they're so becoming so much more advanced than they used to be.
Mm-hmm,
There used to
mm-hmm.
be like simple probiotics. So, is probiotics something that you might work with if one of your patients is really sick from the chemo?
It depends. So there are actually some therapies for breast cancer now that are immunotherapies where actually probiotics are contraindicated.
Wow.
Probiotics can actually decrease the efficacy of those drugs.
Sure, that makes sense.
And so this is where being a very specialized naturopathic oncology
Yeah.
professional pays off,
Yeah,
because
absolutely.
I think a more, a sort of more general practice person might be like, oh, probiotics are the best thing for the gut. You got to be careful and you got to know what you're doing in this population because you can end up harming them.
Right. Well, that's why you're a specialist. Okay, so I know you've helped thousands of women over the course of your career, but I'd love you to share a story about one patient whose life you significantly improved using this integrative oncology approach. Can you think of one? I know you're
Oh,
kind of like, oh,
wow.
geez.
Yeah, I
But
know.
does
It's
one
it's
stand out?
always it's always hard to be on the spot. I think probably I know that I've helped all of my patients.
Of course.
Um, and that the length of life, really, of some of my patients who came to me with metastatic disease has been much beyond treatment expectation. Right, that's one of the things I see. Is I see my metastatic patients live longer than their doctors expect.
Which is like typically
um,
5 years. Is that usually
well,
kind
it
of,
depends it
it
depends
depends on
on
the type and the
where they
stage and all
have
that
it
stuff.
and
Okay.
whatever, right? So, but sometimes these patients are given, life expectancy of like 3 months, right? And I'm able to help them, keep going for 3 years or whatever.
Fantastic. Fantastic.
Um, probably one of the most dramatic cases I ever had was of a woman, and this was very early in my career, and it was like, holy moly. But a woman who was my age at the time that I was treating her, so she was my peer, learned she had breast cancer, and then a week before she was supposed to start chemo, she found out she was pregnant.
Uh-oh.
And this was before there was any real sort of facility in medical oncology to handle patients who were pregnant with breast cancer. I mean, there was like one study out of MD Anderson with an N of like 52 women and what their outcomes were. And she was very clear that she was going to keep the pregnancy. She was very clear that she wanted an integrative plan and that she wanted me to be part of her team. And we successfully kept her cancer under control, helped her deliver a healthy baby. And then once she had delivered the baby, who was not affected by anything that I recommended or the chemotherapy that she did later in the game, this patient underwent surgery and radiation after the baby was born and went from this sort of stage 3 breast cancer crisis with pregnancy to healthy baby, healthy mama. And this was 15 years ago.
And she's still alive?
Hmm.
Oh,
Yeah.
God bless. That's amazing. That's a very powerful story.
Yeah.
I mean, that's the
Yeah.
kind of story that we want to hear. And
Yeah.
we're going to dive in. Normally I talk about the business of medicine to try to help providers understand, the other side of medicine. But with you, because you have such a knowledge base, I really want to stick to the medicine today.
Okay.
If you want, we can talk just to briefly, what is the biggest challenge that you've faced in trying to provide integrative oncology, working with the traditional system? Let's talk about that for a second. Start talking.
To be honest, can I be candid?
Of course, that's what this podcast is all about.
The biggest challenge is the lack of education of medical oncologists, honestly.
Sure, of course,
And
because they didn't get the training.
because they didn't get the training, and there's a lot of bias. And I will say, in any branch of medicine, whether it's conventional medicine, naturopathic medicine, osteopathic medicine, whatever it is, in every branch of medicine, you get the outliers who don't know what they're doing and who put patients at risk, right?
Of course.
But I think it is overall naive to then create a blanket opinion of that entire field of providers, right?
Of course.
We are not all the idiots who don't know what they're doing.
Right.
And, unfortunately, every field has those idiots, right?
Of
Who
course.
create a bad reputation for the rest of us. So I think, I have been extremely fortunate in my career to have some real champion conventional providers who are open and collaborative with patient care.
Great.
And I have had great relationships, great clinical relationships, and great referral relationships with such providers throughout Western Washington through all of my years of working. Um, Other providers are just sort of like, eh, if it's helping you, great. If it's harming you, stop it. And they're sort of neutral, right?
Got it.
And then there's that small group of conventional providers who are extremely opinionated and kind of hostile, right?
Mm-hmm.
So the biggest struggle I've had is fighting for my patient, and the patient gets stuck in the middle of the standard of care breast cancer industrial complex, as I call it, that she gets steamrolled into at the beginning of diagnosis and is expected to follow, right? When she has questions, she has concerns, maybe she wants to do things differently. Women with breast cancer tend to be an extremely well-educated group of people. They want to know what the outcomes are. They read the research. They're looking at new treatments, particularly women with metastatic disease. And these women want something different than
Right.
standard of care,
Right.
right? And so they come to see me or they come to see one of my colleagues, and I'm like, well, we're going to do this. And here's how it's going to fit in with what you're doing with standard of care. And, it's not like I just started doing this, right? And they go to their conventional providers, and maybe it's the, new pharmacist, or it's the provider, whoever it is. And they're like, oh, well, you can't do that. And so then the patient is like, but, Dr. Laura, who's got 25 years of experience, told me I can do this. And now you're telling me I can't. So,
Yeah.
like, that just creates stress for the patient,
Right.
right? That
Right.
just creates stress. And I have tried throughout my career, I send extremely thorough chart notes. I make myself available if the conventional provider has questions or concerns. I'm available on email, I'm available by phone. Like, call me, right?
Right.
And they don't always. And that's the hardest thing for me,
Sure.
is trying to provide the patient's integrative plan in a way that she can do it, in a way that she's going to feel good about doing it, and not get a whole lot of pushback,
Right.
right? That's the
Yeah,
hardest
and I
part.
think I think that is changing. I recently was talking to a physician. She was a neonatal um, doctor for 30 years, and she went into functional medicine, and she's specializing now, excuse me, in hormones. And I told her to go out and talk to all of the colleagues in the community and let them know that they're doing bioidentical hormones. And she was like, "Well, they just don't think I know what I'm doing." And I said, "With all due respect, how long have you been an MD?" She goes, 30 years. I said, "Right. And you chose to go into functional medicine. Why? Because it's more science based." Right. So you need to look at that colleague of yours and say, I've been a physician for 30 years and I'm pretty sure I know what I'm talking about.
Yeah,
So,
right.
I think, as you guys stand up for yourselves and like you said, you share your clinical notes, you share, where you're coming up with this approach. And,
Yeah.
last time I checked, most naturopathic doctors don't prescribe anything that would hurt a patient. So, they need to be a little bit more, open to this stuff. So let's dive into some of the things that I hear. So, uh, I have a girlfriend recently, and I'd love to have you back on a podcast with my girlfriend, who is now a breast cancer health coach, and my Dr. Billstrom, who is an autoimmune specialist, but has a passion for breast cancer prevention, and have
Hmm.
you on the show and the three of you talking, because what a powerhouse that podcast is going to be. That's going to be an amazing podcast. So my girlfriend recently got diagnosed. It was, in just in the breast. It hadn't moved to the lymph nodes or anything. She did a full mastectomy, and then she wanted to do fully integrative. And they were like, "You're crazy. You need to do this." And she's like, "But it didn't spread. Like, the markers aren't there to indicate what you're recommending." And this girl did her homework. Let me tell you what, she is a very, very smart girl. And, Dr. Bolsham talks about all the time, why is breast cancer prevention going and getting a mammogram? Why is that the standard of care? We should be looking at how we
Too
can
late
prevent
by
it
then.
with our food, with our supplements, with our, way before, and it's interesting because my girlfriend said that she's figured out that if she had known 5 years before her diagnosis about all of this, she could have prevented her breast cancer. And I believe her because that's how
Yes
smart
and
she is.
no. Yes and
Okay,
no. I
go
mean,
ahead.
most breast cancers are extremely slow growing. So it's not necessarily 5 years before, it's 25 years before. So it's
Ah,
it's really what are we giving our young women to eat?
right.
What are we, surrounding our young women with? There actually is some compelling research showing that young women who eat tofu have a lower risk of breast cancer. And that's because tofu, which is a very mild phytoestrogen, takes up space in the estrogen receptor, keeping that estrogen receptor from receiving endogenous estradiol. So, it's soy is actually breast protective across the board. Soy is okay for a breast cancer patient to eat.
And I've heard,
Absolutely.
and there you go. And I've heard the opposite, right? So
Well, there've
there's so
been
much misinformation.
in the last 10 years, we've had really, really solid meta-analyses of all the research on
Oh, good.
soy. So
Okay.
yes, it is a phytoestrogen, but it actually acts like tamoxifen, a selective estrogen receptor modulator. It takes up space in the breast cancer, in the estrogen receptor on the breast.
Wow.
So feeding our young women tofu is a really good idea. Tofu, edamame, soy milk, tempeh, whole soy, right? Um, but it's we live in a polluted environment, and one of the other sort of testing lines that's a possibility is looking for microplastics, right?
Mm,
I mean, I really think we're going to get 20 years down the road, and we're gonna know that that microplastics are a big, in general, various types of chemicals in that category are endocrine disruptors, right? They're messing around with our estrogen. So there's a huge environmental load of
mm.
pollutants
Yep.
that we're all exposed to, but our young women particularly, right? Um, and in terms of prevention, it really does come down to this biochemical terrain. And like I was saying before, simple tests that you can get done at LabCorp, or Quest or wherever, those simple blood tests you can start looking at, when you're younger and start adjusting.
I
So,
love
but
that.
but I also will say that 9 out of 10 of my patients will come to me and they'll be like, I've done everything right and I still have breast cancer. And it's like, what do you tell those people?
Yeah,
It's hard,
it
right?
is.
People who are perfectly healthy until they get a breast cancer diagnosis. And this is where I think these, genetic variants in our detoxification systems and our environmental exposure and microplastics and all those kinds of things directly play a role.
I love it. And Dr. Billstrom's even doing kind of a deep dive into um, EMF and blue light. And he found a study about that medication that you mentioned. If a woman is prescribed that medication, but she's getting, too much blue light and EMF and how it disrupts the actual medication. I mean, there's so much environmental that we don't know
Right.
about that can be, hurting or helping in either direction. So I'd love to dive into that when we have you back on the podcast with Dr. Billstrom, because I definitely want to have you back.
Oh,
There's just
thanks.
so much knowledge, and we're already, over our time today with my normal podcast. But I'm just enjoying your knowledge so much. Let's talk about sugar for a second, because I hear everyone say, sugar's, the root of all evil. It's killing everyone. It's causing cancer. And then my friend had cancer, uterine cancer, and her doctor was like, well, you can have a little bit of sugar. What's your take on sugar, Dr. Laura?
So there's sugar and there's sugar. So, I mean, ultimately, when we talk about sugar, we talk about what breaks down into glucose fast. And, glucose is the simplest sugar that floats around in our bloodstream and feeds our brains and feeds our cells. And glucose actually does feed most cancer cells. So when we think about the role of sugar and cancer, simple carbohydrates, but really all carbohydrates will break down into glucose. Glucose feeds a glycolytic cell, which is the majority of cancer cells. So, overall, as a culture, we eat way too many carbohydrates. Carbohydrates are ubiquitous, particularly with fast food. And so, people's carbohydrate load as they're going through their day and their week is generally very high. And this is the primary reason we have such a problem with diabetes, right?
And mental health.
And
I just had a Harvard
and
trained integrative
people,
psychiatrist
yeah,
who's like, keto diet all the way for your mental health. Yeah, it's
yeah,
it's it's
right.
affecting everything.
Right. So, and keto diet, they're, sort of ways to kind of fine tune that. But overall, I recommend a low carbohydrate diet with at least adequate protein, if not high protein, depending on other factors. And when you think about how cancer cells actually work, they're dependent on glucose for their functioning. And if you remove glucose from their environment, then they have nothing to fuel them, to keep going. So they die. And I mean, there's a whole
We could do a
sort of
whole podcast
treatment.
just on that, right?
There's a whole, yeah. Well, and the person you want to have on your podcast is Walter Longo, because he's the longevity researcher at UCLA who looks at therapeutic fasting and what
Okay.
it does for aging and what it does in the cancer setting from the standpoint of improving side effects from chemotherapy. So that, I mean, that's a
I will I
whole
will go
other
I will go after
day.
that man and see if I can get him on the podcast.
Yeah. Good
So
luck.
so Dr. Laura, so am I allowed, if I'm a breast cancer person, I've just been diagnosed, am I allowed to
Mhm.
have a teaspoon of sugar in my coffee?
You can have a teaspoon of sugar in your coffee. What you can't have is a bagel that just has, cream cheese on it.
Okay.
If you're going to have a bagel, number one, have half a bagel. Number two, have it with like a good load of smoked salmon on it, or, or turkey or whatever, right? You
Got it.
never want to eat an unanchored carbohydrate. You always want to have a carbohydrate with a little bit of protein and a little bit of fat. So,
Fantastic. Oh my gosh.
yeah, yeah,
So what's your take on chemotherapy? Do you believe that there's still a need for it? Do you believe that
absolutely.
radiation and do you believe there's
100%.
still a need for radiation? And so you
100%.
support the okay.
100%.
I love that
Yeah.
because I've met some people over the years that have been, you know, given a prescription for chemo and radiation. And they're like, nope, I'm going all whole foods and that's how I'm doing it. And I haven't seen great survival rates with that. And so I'm kind of like,
Correct.
okay. So you're pro medicine, as far as traditional
Mhm.
medicine, and you're complementing that, and you're
Mhm.
helping, and then do you also help your patients with, hey, yes, you do need chemo, you do need radiation, or no, with this type of cancer, you can deal with it without chemo and radiation. Does that come into play with
Oh
you, with
yeah,
your patients?
honestly, all of the major cancer centers in Washington should be thanking me because I get patients back into their cancer centers.
Of course you
I'm the
do.
person who's doing the second opinion, and it takes the naturopathic doctor to tell the patient, yeah, you need to do therapy, right? You need to go have surgery. You need to do chemo. You need to do it, right? So I'm often that second opinion person. And I strongly believe not only does every woman have their own individual breast cancer experience, from what the cells look like to her treatment plan, and beyond, but every woman needs to make an informed decision, and it is the provider's responsibility to outline risks and benefits of whatever they are recommending. And for that woman to make the best informed decision, she needs to know, is chemotherapy going to give her a 15% benefit, or is it going to give her a 2% benefit based on the existing data? Right.
Right.
And if it's a 2% benefit, it's a much different conversation than a 15% benefit. Right. So, it is, as providers, it is our responsibility to give the patient as much information as we can so that she can make the best decision.
I love
And
that. I love
I
that.
feel very strongly that that's the case. And I feel very strongly that women with breast cancer who do an integrative plan do better. And there's some data to
100%.
support that. And, we're
100%.
getting
Well,
more.
it's
So,
common sense, right? Because you're using the traditional medicine, and then you're complementing that with food and nutrition and all
yeah,
of the things that functional and integrative medicine brings to the table. Of course, you're going to have better outcomes. This is common sense. So thank you so much.
you're
If there's
welcome.
one message that you want listeners to take away today about functional oncology, what would it be? Or integrative oncology, what would it
Ooh,
be?
yeah. I think being diagnosed with cancer of any type is an extremely difficult thing. And it is, I think, very important, number one, to build a team around you, both your support team and your medical team, that you trust. And you're allowed to switch. If you don't like your doctor, you can switch.
I love that you said that, because I had a girlfriend
Build,
ask me that recently. Can I switch? Because this
oh, you can
doctor has
absolutely
horrible
switch.
bedside
They
manner.
don't like it. They don't like it, but you can absolutely switch. Build a team that you trust, support and medicine. Ask for what you need and gather as much information as you can to make informed decisions.
I love that. And what is the best way to reach you, both for your colleagues? So if we have,
Mhm.
oncologists out there that are like, I'd really like to pursue this integrative approach or this functional approach to oncology. What's the best way for them to reach you? And then what is the best way for a patient to reach you if they'd like your services?
Sure. So my website is just laurajamesnd.com. And I have an email address, info@laurajamesnd.com.
Perfect.
Patients have an option of working with me directly. I do consultations, but I also have a big online program called Facing Your First Year with Breast Cancer, which basically gives women all the information they could possibly need, as
That's
well as
awesome.
monthly live group Q&A with me and my team. And I do a whole bunch of podcasts on other people's podcasts, and I'm writing a book, which is going to come out in 2026.
Yay.
And I have a newsletter. Patients can sign up for my newsletter. That's free. And
Fantastic.
if providers are interested in what I'm doing, yeah, they can just email info at, um, and yeah, check out
You're
all
ha-
the other
you're
things I'm
happy to
doing.
you're happy to take them to school.
Yeah, exactly.
All right. Well, thank you so much for being on the podcast.
Yeah, thanks
It's
for
been
having
very
me.
informative, and Can I ask you, will you come back? I'd love that. We'll
Absolutely.
do it after in the new year, after
Yeah,
the holidays. All right. Thanks again, Doc.
sure.